So today we're on week 2 already, and it's going to go by pretty quick. On Friday, you're going to be getting some messages that's going to give you all the exam reviews for next week. It's going to give you all your study guides. It's going to give you weeks 1, 2, 3 Kahoots. All your information you need to study for the exam is there. I'm doing my exam review on Tuesdays at 6 p.m. That's when I've decided to do it. So, yes, it's going to be recorded. The other thing, it's going to be in one announcement. Everybody's recording. I just keep editing the same one. You don't need 8 recordings and 8 different announcements. One place, one stop, one shop, because I don't want you all of that confusion. 3 classes is enough, and I know professors love to send those announcements and over like you didn't hear it the first 3 times. Let me give you another 3 times to make sure you understand me. I don't do that. If I see something going wrong individually, I'll let you know. I'm not going to let the whole class go with the whole thing. Anyway, so today we're going to be doing chapters 31, 2, and 3. We're going to do chapter 31, infant, and then we're going to do a cahoots. And it's a great split up. Infants is the biggest growth and development that you need to know. Okay. And I want to tell you a little story about me and growth and development. When I was working in pediatrics, many years ago, they started with these certification exams, right? So you could do pediatrics. At the time, I was working in the emergency room, but I've been in peds since the 80s. So I'm really varied from ER to newborn ICU to ICU. I can work floor, I can work anywhere in pediatrics. Okay. So they wanted us to get a certificate exam in order to get the highest level paid nurse. Of course, you're going to do it. Well, I didn't do the certified pediatric nurse exam. I did the harder exam, the certified emergency room nurse. And do you know why? Pediatric exam is all growth and development, and I couldn't keep it straight in my head back then. Can you imagine? So I understand your frustrations. That's why I try to make it in a manner and describe it that you can remember it, because I could do it now. Yes, because I teach it over and over again. But back then, I understand growth and development is very hard. And then our second part was going to be toddlers and preschoolers. And there's only one cahoots for them because they're very similar with some slight differences. So we'll get to that. Any questions about anything? Okay, let's go ahead and start with our PowerPoint, week 2. Again, you got all this stuff in your announcements. I didn't hear anybody that couldn't open it, so I'm assuming you were able to open it. I do always put, whether it's an answer guide to a handout that I give you, and there's a couple that I give you during the term, that's only in the recording, after class, so that you have them. And I always repost the PowerPoint just to make sure, because there's great information here. It's a good guide to study. So let's look at infants. I think infants are remarkable. As I said last week, babies are born, and I always pick 7 pounds. That's probably the biggest number. Babies are born 7 pounds something. So they're born at 7 pounds. In 6 months, they've grown 1 inch per month for 6 months. So 6 inches they've grown, and they've doubled their birth weight in 6 months. Then by 1 year, they triple their birth weight. And they don't quadruple their birth weight till 2.5 years old. So you can see first year, big thing. So what's the most important thing for infants in the first year of life? Nutrition,
Nutrition.
nutrition, nutrition. Okay, now you understand why, right? Because of this huge growth. So, feed them, tank them up. They're hungry, feed them. I mean, unless you have a baby born at 7 pounds who is 18 pounds at 6 months, well, that one's overfed. But most of the time, feed them, let them go, feed them, feed them, feed them. So we know a baby is born and they can't lift their head. And by 1 year old, they're walking or attempting to walk. So even gross motor movements, their hands, they don't work at first. It's a reflex. And in the end, they're pulling things out of containers and putting them in and building blocks. They're using their hands, those fine motor skills. So this is all the stuff that happens. So if I don't get enough nutrition, cognitively, they're not going to be there. We're going to be able to see that in the weight. One thing we do every visit for a pediatric child, whether urgent care, in the ER, doctor's office, we're going to do a height and a weight. And why do we do that? Number one is measuring nutrition. If they don't have enough nutrition, then cognitively, they've not had any gasoline to fill the tank. Are they where they need to be? At 6 months, are they rolling completely over? And they should be. By 8 months, are they sitting unsupported? They should be. And if they're not, their weight is low, we know it's due to nutrition. Nutrition, nutrition, nutrition. So as we get older, as I said, neonates, first 28 days of life, they're going to be breathing 40 to 60 breaths a minute. Their heart rate's 140 to 160. And as that vital sign sheet showed you, it decreases the heart rate and respiratory rate as we get older. And the reason why you need to know that is, what if you're giving digoxin? What if you're assessing for dehydration, pain? You're talking about fever, right? All those things should have elevated heart rate. Well, is 140 to 160 on a neonate elevated? No, but it could be on a 1 year old. So again, knowing sort of, well, that doesn't sound right. All right, let's check that out. Always stop, always ask the doctor. Now, another thing that occurs in children is babies are born with mommy's immune system in their blood, their iron in their blood, right? And then the baby doesn't start making its own blood till somewhere around 6 months, somewhere, a little before, a little after, somewhere at that moment. It is not uncommon to see an infant at 6 months old with a hemoglobin of 10 because they're not making any of their blood cells yet. So what are you going to see? Well, these children will have low hemoglobin hematocrits, and as long as they're not symptomatic, we expect it. Why do you think we give the formula? We give iron fortified formula because mommy stuff's going away, right?
Mhm.
And then at 6 months, why do you think we give iron fortified cereals? Because again, we need to put that iron in there. And the vitamin D helps with breastfeeding. So all of these things are because now mommy's immune system's going away, all of her blood cells, iron is going away, and that baby does weaken, and that's why they get a little sicker, because now the body needs to get sick to make its own immune system, its own antibodies to fight whatever that's going on. And then it starts producing its own blood cells, and we eat proper iron, and life is good for that infant. And that's why we feed the iron and what happens to them. Now, their heads at birth. You were taught in OB that their heads are bigger than their chest at birth because the head has to get out, and everything else will come out no problem, right? Well, that big head is equal to or less than the size of their chest by about 1 year, 15 months. So, why do I need to know that? Well, we do head circumferences on children because they've got these soft spots, these open things called fontanelles. There's one on top of the head called the anterior fontanelle. That's the one that's open the longest. That's maybe up to a year and a half. You're going to see it open at some point. There's one in the back of the head called posterior fontanelle. It closes so quick we don't even really know it's there. By 2 months, 3 months, the most, it's gone. Okay. Now, what if it closes too early? What if it's open later than it should? All of these things are telling there's a problem. It's part of the growth and development. You need to know when fontanelles should close normally. The one in the back, posterior, less than 3 months. This one says 6 to 8 weeks, but some book says up to 3 months. And then the one on top, it's going to be open till about a year and a half. All right. Another things with infants, when they're born, they don't see. Each eye works independently, and this is called binocularity. Means bi, too. You have two eyes, they both work in their own way. They don't work together. And the only thing that means is there's no depth perception because you need two eyes to get to that point. One eye will get you here or over here with the other eye. Okay. You need both. And that will start at 9 months. That will be able to more depth perception as they get older, more and more. So the immune system, as I said, starts with mommy, and then we start giving those immunizations. Did you all get to look at the book on that 2-page spread of immunizations for infants? It's crazy. And there's a lot of them. So what do you need to know? Well, the first one's given is hepatitis B. You have to know that one. Then you need to understand that 2, 4, 6 months, we're giving a load of them. And this is in order to increase the immune system of that child. Flu vaccine is not given till 6 months old. It's another important concept there. We don't give them till that point. We know that body and that infant, it comes out as brittle as mommy stuff, it goes away, and our goal as healthcare provider is keeping them healthy, preventing them from being sick, right? And making sure they get all the immunizations and all the teaching they need in order to help the child. We know breastfeeding increases the immune system of that child more than bottle feeding. And we'll go on more and more about what breastfeeding does. Another thing, thermal regulation. If you've all had a baby or have watched a delivery, we know that babies are born out of a wet mommy, right? And they're wet, coming into this cold air-conditioned room. First thing we do, we dry them off, put a hat on their head, and put them underneath a heated warmer because they cannot regulate their own temperature at birth. As they get older, they're going to start getting that fat tissue, right, from eating, and it's going to protect them. So the first 6 months, you got to be sort of worried about the temperature, but after that, babies can hold a lot more. I mean, at birth, think about it. What has the baby been doing for 9 months? It's been floating around in liquid, and your body absorbs it. So you're sort of swollen, that extracellular, right? Is also in your face, your eyes. Ever see a baby at birth? They got big puffy eyes, and then they go to the nursery, they come back, and their eyes aren't puffy anymore because they urinate. They get rid of that extra fluid that's over there. Absolutely normal. But that's what makes that child get not be able to regulate their temperature, all that extra fluid. Now, I mentioned fingers, fine motor skills, important. At birth, a baby doesn't know how to breathe. We smack their butt or whatever we do, right? And they go, wah! And then they cry. So now they've got a voice. They know that. Then, of course, what do? We stick a bottle or a breast in their mouth because we want them to eat. So now they have to learn how to suck, swallow, and breathe. So that's the beginning. Then mommy goes up to the little, crib and goes, oh, what a pretty baby, puts his hand next to the child, and the baby grabs their finger. And the mommy goes, oh my goodness, my baby loves me. He's hugging my finger. Please don't tell him it was a reflex. Don't tell him that it was not them at all. It was the baby doesn't know better and it was a reflex, and you're just helping them to learn. Say, oh, isn't that sweet? We know that they're not going to grasp by themselves to somewhere about 5, 6 months. Okay, it's later on. That reflex is learning that I like it. We call grasping things, another word is called prehension. Why that word? I don't even have a jingle lingle. I don't have something even to equate that word to help you. It's just called prehension. It's that grasping, what infants do. Now, initially, we get that reflex palmar grasp because it's mostly with the palm we'll grasp. It's not with the tippies of the fingers, okay? And then it is a voluntary grasp. All right. And then about 7 months, we take that rattle, let's say it's in his hand, and we can put it to the other hand. So now we're transferring things back and forth. What else do we do that rattle? We shake it. We like the noise. We're learning. Cognitively, we're learning. Put it in our mouth. We suck on it because we explore worlds in our mouth. And I like it. I like it. Right? I'm satisfied. And then we get in the high chair. And now we're going to use our fingers a little more. So then mommy gives me these little things that I can push in my mouth, Cheerios or little puff things or what, little pieces of soft food. And they take their hands and they swoosh it in their face at first. And that's called a crude pincer grasp. And then all of a sudden they take their thumb and forefinger and one by one, ooh, one at a time. And that's called a fine pincer grasp. Okay. So you start out with a reflex, then it becomes voluntary, then you get a crude palmer pincer grasp, then you get a fine pincer grasp, and then at 11 months, you can put objects in or out of container. And then by 1 year old, a minimum building blocks, put a block on top of each other, a block tower to 1 year. That's the progression of fine motor hands, F for fingers. And that's a test for you. Now, gross motor skills. I call this get up and go, 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 like Paw Patrol, which means movement. Okay. So, gross motor is movement. The first movement that a child does or gets control over, motor development, control over that motor, is their head. We don't at birth have any control. We have a floppy head and they don't hold anything. Okay. And then about age 2 months, they're starting with that head control. By 3 months. Absolutely. At 5 months old, if you have them on their tummy doing tummy time, all of a sudden they're going to flip over. Ooh, they're on their back. That's about 5 months. In about a month, they're going to go from their back and flip over to their abdomen. So by 6 months old, they're rolling completely over. What safety tips are you going to teach that parent at this point? Always have a strap on them on the changing table, side rails up on cribs if they're in there, right? Because not on top of tables, because they will roll over and they will fall down. And I've seen a lot of kids fall off of changing tables, less than 1 year old, like about 6, 7 months old, because oops, they're just starting to roll. Just be very careful. That's teaching, very important in peds. Now, by 8 months, they should be sitting up unsupported, not pillows propping. They should be able to sit there and they should be able to play. And then, about 10 months old, they're on their back playing, and then all of a sudden they just roll over and just sit up and they continue to play. That's about 10 months. And then they say at 1 year, they're either walking or attempting to walk. Okay. So, locomotion. So now we know the movement things. Now let's look at them getting up and go, go, go. And that movement is part of it. So we know it's a cephalocaudal direction. Remember, cephalo is cephalic. Cephalic means head. Caudal is the lower spine or your feet. So you move your head to the, and by the 1 year old, you're walking or attempting to walk. The in betweens you need to know. Well, you're rolling, well, your head control by 2, 3 months. You are rolling completely over by 6 months. And then you're up on your knees crawling. It's usually backwards first and then forward. And then you're creeping. Creeping means standing up, holding on to something, usually a couch, a coffee table, and walking around it. That's creeping. And then walking with assistance, 11 months, and walking alone or attempting walking alone at 1 year. Those are the growth and development things that you need to know. Now, nutrition, nutrition, nutrition. The first 6 months of life, we're only going to be giving milk, whether it's breast milk or iron fortified formula. Nothing else should be given. The only time that we give something else in the milk is when a baby has reflux. And we'll put a little of rice cereal in it, only to thicken it and hold the milk down. It really doesn't play a nutritional component, but it holds the milk down so it keeps the calorie count up, which is what you're concerned about. Okay, it's the only time. So before that, it's only milk, breast milk, or iron fortified formula. We know babies should breastfeed each 10 minutes each breast. Yeah, for sure. Breastfed babies will be getting vitamin D. It's also part of their bone and their muscle development. Now, babies are born and they lose up to about 10% of their body weight. And that's within the first couple days. But within 2 weeks, they are back to their birth weight and gaining weight more. One of the biggest concerns I hear all the time, working a lot of newborn ICU and cardiac ICU that I have, is that mothers are concerned taking babies home that are being breastfed. Are they getting enough milk? Because in the hospital, we always measure everything. Everything's in a bottle, a syringe, or something. And parents get into that. Oh, they had 28 cc's of milk today, and they get into that. Well, at home, they're just going to breastfeed. How does that mother know? Well, the first way is that the baby has 6 to 8 wet diapers. Whether it's stool and urine, they're wet. That's just considered something coming out. That is showing that they're hydrated enough. Okay. And then the other thing, don't we send these babies to the doctor frequently? They go home. Within 2 weeks, they're back to the doctor to be sure. 2 months, they're back. 4 months, 6 months. So we are measuring that if they're getting all of that nutrition that they do need. Now, why don't we feed babies food in the first 6 months of life? Because there's been all things. Some pediatricians, old pediatricians, says, "Oh, go ahead and feed them." Some don't. Well, what the literature says in the research is that infants that are born, their gastrointestinal systems is very immature, and it doesn't handle food besides milk, which easily digestible, very well. And you are actually going to see food in the stool. I mean, we're adults, right? You eat corn. Aren't you going to see corn in your stool? Same concept with infants. They eat peas or beans or carrots or whatever. You're going to see that color or that piece of that come out in the stool, which means they haven't digested it. All right. And we know that goes on for life, but as long as they're getting most of it, they say do not feed them till 6 months and then go ahead. We start feeding them their foods. Now, how do we start feeding foods? Important. We don't know what allergies this child has. And that's our biggest concern in anything we introduce to this child, whether it's a cream, a lotion, a drink, milk, or a food. Is that going to put them into anaphylaxis or create an allergic reaction? So, one food at a time. Wait 4 to 7 days, and then you could put another food in there. Once they've shown no allergies to something, you can add that into another food. Okay? One at a time, 4 to 7 days in between. As I said, there's all sorts of allergies that you're going to be looking for. I mean, this child has severe eczema, psoriasis, due to food allergies or environmental, whatever. But these are things that can happen. And it could be due to milk, could be due to a protein, it could be due to something. So, again, being aware, telling your parents that if we see something like that, let the doctor know so that we can do changes or figure out what's going on, right? We know that the biggest thing with these children, and in my career, what I have seen, blonde hair, blue eyed boys tend to be the most sensitive to things like skin things. And then it's the girls, blonde hair, blue eyes. Then it goes to the brown hair eyes, et cetera, et cetera. It's what I've seen. They tend to get more, or maybe you can see it better. I don't know. But again, it's eliminating foods, figuring out what they're allergic to. And then, of course, do you have an EpiPen? My grandson is highly allergic to shell nuts like walnuts and pistachio. He just licks it on his tongue and he just blows up. Again, making sure we have EpiPen or getting that child desensitized. Now, infants sleep a lot. We know that they usually, sleep all night long by about 3 to 4 months. Hopefully, mommy and daddy can finally get some rest, and then they're going to take naps during the day, 2 or 3, depending. We know breastfed babies wake up more frequently. They actually consider breast milk a clear liquid. It's not as concentrated or thickened looking, I guess, as would say the iron fortified formula. Formula babies tend to sleep longer than breastfed. It's just what it is. Your book says walkers and swings and playpens, none of that's necessary, but we all use them. And the kids like to swing and they like use their walkers, etc. My 10-month-old grandson has his, what I call his F1 flyer walker, and I've got a big cement patio in my backyard, and that kid can go from one side to the other in 3 seconds flat, and he's 10 months old, and he's gone. I think it's great for exercise, but again, it's a parental choice. Teeth. The earliest a baby tooth should come up is 6 months. They say if your baby's 8 months old, if you minus 6 months, the baby can have up to 2 teeth. It doesn't mean they have 2 teeth at 8 months. It only means they have that possibility. My kids never got teeth by 1 year old, no. Both my children and both my grandkids, they did not get teeth till 15 months and they got 6. So again, it's all different. Children are all different. Another thing about children and their teeth. Once they get their teeth, we should start brushing them. Just the toothbrush. You don't need toothpaste, yes, till later on, not as an infant, okay? They are also telling you no juice, milk in the bed. All right. No bottles there. I mean, if they have to have one, water only, and they actually prefer, just give them a pacifier. I think you heard me talk last week about pacifiers. There's been so much controversy in my career. I've seen it. They're good, they're bad, they're good, they're bad. Well, the new research says that pacifiers are good, that they're good because we know babies and young children explore the world in their mouths, and it's a way that they soothe themselves. And it's something that during the night, pacifier up, put in their mouths, and they can soothe themselves. All the immunizations. Measles is not given till 1 year old. Varicella is not till 18 months old. Influenza is 6 months old. And we know hepatitis is the first one. Now, kids can get colic. This is gas. And usually it goes away in 3 or 4 months, hopefully. These are children that no matter what, you feed them, you burp them, they're on all meds, whatever, they just have gas and they're irritable. And it does take a patience of the parents with these children. We know some kids sleep a lot, some kids don't sleep at all. And then there's something else that we call failure to thrive. This would be placed on a child that was born at 7 pounds, who came to the doctor's office at 6 months, and they weighed 9 pounds. This child's not gained double the birth weight by 6 months. That child is what we call a failure to thrive. What are we going to do with a child that It's too small. And I'm sure cognitively they're behind, in all of their milestones. They're just not meeting them. Well, this is a child, number one. You're going to get that diary from the mother. What is the kid eating and how much? And you're going to look at stools and urine also. Those are very important. And then we're going to go and find out, is it an allergy? Is it a metabolic problem? What's going on? A complete workup that has to be done because nutrition, without it, this child is not going to survive. It's not going to grow. And cognitively, it's not going to be where it needs to be. Another thing people are concerned about, especially today where we promote putting a baby on their back to go to sleep. We have seen a decrease, significant decrease in SIDS death when we place our babies on their backs. But what happens is the back of their heads get flat and parents get concerned all about it. So if a parent came up to you and said, my baby's getting flat in the back, what can I do? Well, when the baby is wide awake, you do tummy time. And those scalps are very soft and malleable. And just getting them a couple times a day off their head, their back of their heads will help it to round out. Now, if it's really severe, like that top picture looked like that kid was a premature child who had to be placed on his side and not move, probably respiratory, something going on, and the side of the head got a little flatter. That child might need the helmet. And you've seen them probably in grocery stores, kids with the helmets on their head. All they're trying to do is make their heads, be more rounded. And it helps. Yes, it does. Sometimes you don't need it, sometimes you do. Another issue with children is, oh my God, that dreaded diaper rash, right? Child gets a diaper rash, what's going to happen? Every time they urinate or stool, the kid's going to scream because it burns. This is going to be a child who doesn't sleep at night. So you do not want diaper rashes. So what do you put on it? Well, number one, you wash it with soap and water, clean it, dry it, and put on some emollient to keep it from getting urine and stool on it to keep it from burning. Many times, diaper rashes is either food allergy, or it could be a diaper allergy. My kids couldn't wear Pampers, they can only wear Huggies. And my other grandson is opposite, only wears Pampers and not Huggies. So again, right there where the diaper went is where the rash is. It also could be due to a change in detergents or lotions or creams that you use on that baby. But what we do is keep it clean, dry, emollient cream, and our biggest concern is sleeping. You don't sleep with that. Another thing that children, infants, is cradle cap. Now, cradle cap is that flaky, dry scalp, and it needs to be washed normally, like you normally would, soap and water, no big deal, and then put an oil or moisturizer on it. Some parents like to clean it, moisturize it, and then in the morning wash it again, get the oil out for the day. But just a fine tooth comb, and you could just very easily, it's not going to go away in one try. It's going to take several times, washing it, putting cream and moisturizer and oil on it in order it to get that flake away. And then SIDS death. You heard me mention it several times. So what they started, and I know back in the 90s, they've been doing research on children and positioning for sleep. I know they've changed this research many times. They used to say you could put them on the side or their back, never on their tummies, okay? And then they realized on their side, they're breathing their own air in, CO2, and there was still an increase. So now only on the back, what they say is for SIDS death. So, what are your risk factors? Well, males are at higher risk than females. It's usually before 1 year old. Okay, only infants First year of life only, around 2 to 4 months is your peak that you see it. Usually these are children that are put on their tummies or prone to go to sleep. They get so asleep or they vomit, their face smushes in it and they have no neck control, remember? And they smush in it and they can't breathe and they die, they suffocate. Could be due to cigarette smoke. Cigarette smoke should never be around children. Ear infections, increased SIDS death, many reasons why not to smoke in front of children, okay? Overheating. We tend to overdress infants. If you are comfortable, a small infant just needs one more layer of clothes on. They don't need any more than that. Breastfeeding has decreased SIDS death. So it's okay if you have to bottle feed your baby. I mean, it's a choice. Breastfeeding is a big deal to do, especially if you're working. So, but know that there is an increased risk. We know that poor socioeconomic conditions could be air conditioning and heating and all that not done. Immunizations not being given, big thing. And then co-sleeping with a parent. I've seen a very large man with his newborn baby in the bed, and he rolled over at night, suffocated his baby, didn't know, and they brought him into the ER, and the baby was pronounced dead on arrival. So it's something that happens. All right, it does. So something we should teach. Never put the baby in bed with you. Now, one of the things that happens with infants is they have what we call these aborted or near missed, we call them ALTs. It's an acute life threatening episode, ALT, all right? Event, episode, whatever you want to call it. And usually, what I've seen with it is the parents come in and say, my baby took a breath and stopped breathing, and they turned blue. It could have been reflux type thing where they couldn't catch their breath, but we don't say it's reflex. What we do, these children are admitted and we do a neurological and a GI workup on them. And because they have this episode, they'll be sent home on a apnea monitor. And it's a machine, it monitors heart rate, and it's something that has an alarm on it, and you could set the alarms, and it's got this ear piercing alarm. So when it goes down, which means they're not breathing or bradycardia, then that alarm will go off. Usually it will jar the child, hopefully will wake you up and be able to go in and jostle the child so they don't have an acute life-threatening episode. Now, big thing in children in pediatrics is car safety. Safety. Most accidents are what? Motor vehicle accidents. So it starts with making sure children are placed in the car seat correctly, okay? Another thing with injury prevention in children, they're doing it a lot now, teaching new mommies and daddies CPR so that in case something happens, teaching water safety on children. I mean, I live in South Florida. I've seen a few drownings, and when they drown, they go down, they come up, and they stay alive, and their brains are not what they used to be. It is really scary, and it's I feel really bad for these parents because of drownings. So question, Letitia's a breastfed infant being seen in her clinic for her 6-month checkup, and then the mother tells the nurse that she's recently started to suck her thumb. Which of the following is the best nursing intervention? Do you want her to suck her thumb?
No.
Is it normal?
Yeah.
Yes.
Everything goes in their mouth, right?
Hmm.
So reassure her. Absolutely normal, and that's what we like to see. So, theorist. On your first exam, there's about 6 or 7 questions on your theorist. These are the 4 that you need to know: Erikson, Piaget, Freud, and Kohlberg. I'm going to try to explain them in a manner that you can remember which theorist is which. Erikson. Erikson talks about the people around the child. So I'm the child and you're the people around me. And how am I responding with them? And how do they respond to the child? That's Erikson. All right. What do infants need from the people around him? He needs to be picked up when he cries, needs to be fed, burped, changed, and put to bed when he wants to sleep, right? So
Mhm.
when that baby goes, "Ah," and mommy goes in there, picks him up, takes care of his needs, you've got this happy, healthy, sweet baby because he trusts that he knows that all of his needs are being met. He doesn't know anything else. And that's what you want. Now, there are times in relationships where a baby's going to be crying, and I'm not talking 1 or 2 times. I'm saying most of the time, the baby cries, nobody goes, doesn't pick him up, none of his needs are barely even being met. This baby shows mistrust. How would you know the difference? Well, when a baby doesn't cry, doesn't really want to be picked up or look at you, there's a problem. Or doesn't try to get back to mommy, there's something going on there. Now, when do you see mistrust? It could be in a relationship where there's some sort of drug, alcohol abuse, could be some sort of socioeconomic homelessness or something of the sort. But again, there are situations where that mistrust is at a higher risk than a baby with that trust. Now, Piaget. Piaget's all about the mind. Remember, we don't even know how to grab a hand at first. That's a reflex. And then all of a sudden we get old enough and realize I can grab that myself and it becomes voluntary, right?
Mhm.
So, what this is telling you is you need to do something that sparks the understanding. My schema was I reflex grasped and I got mommy. Then I realized, oh, I touched that. Oh, let me grasp that too. Now I became, the schema was now I voluntarily grasped that rattle. Then I moved my hand, it made noise. So the next time I got that rattle, I grasped it and went, because I like that noise and that's so much fun. Oh, and then it dropped in my mouth. Now I like that rattle there too. So you started out with not knowing what to do. You took a reflex, grasped it to a voluntary to now rattling it, now putting it in the mouth. So that's what a schema means. You build from little and you make it more. And that's how children learn. Remember, they don't even know how to breathe when they're born. So, sensory motor, first 2 years of life. Infants, preschooler, they're learning how to walk, talk, communicate. They're learning things roll, push, hard, soft, cold, hot, slimy, all different. They don't know any of this when they're born. That's that first um, time where they're learning. As they get older into toddler, now they can start manipulating things. And I love toddlers. Take a sippy cup that's sitting on your high chair and the baby's eating. Mommy went to the kitchen to get something else for the baby or finish dinner or whatever. And that baby wanted mommy there. They go and they smack the cup just to look for mommy and it fell on the floor. And mommy come running over, got the cup, rinsed it off, and sent it back. And then toddler goes, now I know how to get you, mommy. So the next time mommy walks away, wants somebody there, throws that sippy cup on the floor because now I know how to get mommy to come back over here. That's imagining. This is magical going on. And we're going to go further into stuff as we go up the line of toddler to preschooler. So we went from, I don't even know how to hold on to you, from that really reflex grasp. Another thing that happens in this time is body image. They're starting to look at themselves in mirrors and glasses and stuff, and they're starting to touch things and realizing, right? Again, we know mouth is all about figuring out life is there. That object permanence, that's when you put a new toy in there and the baby likes it, and then you hide it and you put them on tummy time, and that baby knows it's there somewhere, and they go scoochie scoochie, and I'm trying to use my muscles, trying to go over and find it, because even though it's not visible, I know it's there. That's object permanence. That's what they know. Infants, we know that they like mommy and daddy, usually don't want to be taken away. There are things called separation anxiety. We'll go into that further when we get to toddler preschoolers because it's a three-stage thing. There's stranger fear. You know, we're the stranger. Mommy and daddy bring the baby into us as a nurse. We're the stranger. And they're going to try to not look at you initially. As they get about 8, 9 months, they're going to start peek around the corner to see, is she still there? Right? And they still want mommy there. We know as they start as infants, they learn how to cry first, right? Then they start to coo and giggle and all these things. It's that language. And then, as I said, what do children do? Infants, all the way up, even us, what do we do all the time? We play. We play. Somehow, some way, play. Very important. Let's go to our first cahoots. Any questions? It's a lot on infants. Remember, I do not look who did what on these. I don't look if you got 10 right or 20 wrong. This is a test for you, not for me. So don't be afraid to join.
How do we join as a participant?
Take your phone, open the camera, and put it on that Q, whatever that thing is, that Q code up there. And
Perfect.
you'll go right to kahoot.it or go to kahoot.it and put the game pin in. I think it's through the phone is easy. Anybody else want to come?
I'm trying to get signed in.
All right. Infants. Again, this is the growth and development that's hard to get unconfused. An infant should triple their birth weight at what months of age? And 1 year old, they're going to triple it. Very good. An infant should blank their birth weight by 6 months. They double it at 6 months. Very good. A multi. Infant nutrition includes. I don't cover everything in the PowerPoints because it's hard to cover them all. And this is one of the concepts I wanted to make sure I didn't forget. So, of course, I put it in as a coots. You're going to see not everything's on a PowerPoint. Some of it I'll put here because you just need a question on it. So, infants can't have honey for the first year. It's a big concern on botulism and the processing of it, and infants can't handle that with their immune system. So, that's the big thing. Another thing, they can start cow's milk, whole milk, at 1 year old, not before. They give it before, they're not getting the nutrition. And again, nutrition, nutrition, nutrition. So, those are the two things. We're going to introduce foods one every 4 to 7 days. And you can give finger foods as long as you can pick them up and they don't choke on them. It's not a problem after 6 months old. A multi. Infant nutrition for the first 6 months. So, first 6 months is human breast milk or iron fortified formula only. That's not the DHA, not lactose free. I mean, it might have to be a lactose free iron fortified formula, but it's going to be iron fortified formula form that child needs. Yes, you do have children that don't like lactose. Nutrition interventions for an infant include. So, what do we know about infants? Nutrition. So, remember, if the baby is being breastfed, that baby needs vitamin D drops also for that good muscle building, okay? All formula has to be iron fortified. And again, one food at a time every 4 to 7 days before adding a new one. An 8-month-old infant should be expected to perform which fine motor skills? Remember, F fine fingers. This is one thing on questions students don't get right. Remember, is it gross motor or fine motor? They're different answers. So a 8-month-old should be able to voluntarily grasp a rattle. And then of course they're into that crude pincer grasp. It's about 10 months when they get more of the fine pincer grasp. Which of the following is an example of fine motor skills in infants? So fine motor skills is F fingers, anything with fingers. Crawling, rolling, and jumping is get up and go, go, go. Gross motor skills. I put this question in there just for you to see it. We know grasping with thumb and forefinger pincer. Yes, that is fine motor. Which is the correct order for development of gross motor skills in infants? So movement, what do they do first? First year of life, they do a lot. So the first thing they do is their head. This was an easy answer because it was the only one. It's head rolling over, and then they're crawling, they're creeping, and then they're walking. Very good. At what age can an infant typically sit unsupported? No pillows, nothing around there. They sit by themselves. This is a HESI question they love, believe it or not. It's one of those pick out growth and development questions. This is the one. It's 8 months old. Okay. Earlier than that, they can sit, but usually pillows supporting them around that. At this time, they can sit without falling over. At what age does an infant typically start rolling over? Rolling over. We start from the abdomen to their back, and then they go from back to their abdomen. So what time does it start? So it's 5 months. They should be completely rolling over by about 6 months. And again, what I want you to think about when you start movement, think about safety. This is something you're going to see questions regarding safety. What am I being concerned about with a child who's 8 months old? You be concerned about the child now can sit more mobile, and you need to strap them in if they're on a changing table or on anything. If there's a car seat, stick it on them. An infant's head circumference is. One of the things we do with infants in the newborn or even the cardiac ICU for newborns is part of our initial assessment is to do a head circumference, a chest circumference, abdominal circumference, and then we will also do their height also. And we know at birth that head is big because we got to get it through the birth canal and then the chest comes behind. Remember, head and chest should equal about 1 year old. That's a significant growth and development question. How do you apply nystatin to an infant with thrush? Again, it's a procedure. This is pediatrics, a child. How do you give it to an adult? You swish and swallow. You're not going to do that to an infant, right? You're going to paint it on with a cotton swab. Very good. Blank is contraindicated for treating fever in children. Remember, we do not give aspirin to children. Reye syndrome is a metabolic condition that if you give them aspirin, these children get extremely sick. There's one condition in week 5 I'm going to teach you that you give baby aspirin to. Nothing else. You should never give it because of the risk for Reye syndrome. You usually give aspirin or Tylenol or Motrin, whatever, for a fever, right? Usually fevers are a viral syndrome. Well, viral syndrome and aspirin equals high risk for Reye syndrome. So again, we don't give aspirin to children because of viral syndromes, and that's mostly what they have. What is the primary goal in treating fever? Do we have to treat a fever? So you don't have to treat a fever. In fact, I've had parents very upset, and my baby has a fever of 104. You need to see him now. And I'm like, okay, I'll be right with you 1 second. But be assured that once you have the fever, the risk for seizures are almost nothing. I've never, ever, even I've seen 105.6 axillary, 106 point something axillary temperatures and never a seizure. Most parents are concerned about those febrile seizures, right? And it's not that they have a fever, because once they have a fever, think about it, they're safe. So, treating the fever. Why? How do you feel when you have a fever? You feel horrible. Once the fever is treated, children almost act normally. What do we need to do to treat fevers besides medicine? Fluids. Is a kid going to drink anything when they feel horrible? No. Get the fever down. They're going to drink your fluids, and then life is good because that's what you need to have happen. Infants Erickson stage. Erickson. Erickson talks about people, the way the infant reacts to people. So again, infants trust somebody's going to come get me because when I cry, somebody comes. That baby's happy and healthy, and it's just, a better baby who's more well-rounded. The mistrust be that baby who's maybe doesn't cry, sits there in the corner, and you don't see that personality in them. What pain scale is used to assess an infant? So when we talk about infants from 0 up to 3, it is FLAC. Also remember, FLAC is for nonverbal. Could be 18-year-old cerebral palsy, okay? Nonverbal, 0 to 3, FLAC. When they become 3, and you can use it for adults if you want, it's going to be faces, and they're going to pick the face. And the beauty about kids, they give you the exactly how they feel. Adults, we're a 20 pain scale all the time. Multi. When is the best time to assess an infant? You had an admission, they're an infant. When do you think? You need a good assessment. You need to know what's going on, right? Where is a baby happy? Well, number one, if mommy's holding them, they're going to be the happy. Less stress, less pain, less fear for everything. It's part of my research that I had done. Of course, and if they're sleeping, you can listen to breast sounds if you don't tickle them too much with your stethoscope. All right. But again, those are the best times because when they're awake, they're and they're moving, hard to hear heart sounds, hard to hear breast sounds, and of course, abdominal sounds too. Where should you place a car seat for an infant under the age of 1? One of the things with safety is car seats and knowing ages of children and where car seats should be placed and how, a very important thing. Remember, infant should be back seat rear facing, and they actually say now it's in the middle. It should be not on that passenger side so mommy can look. They say in the middle because it could be hit on either side. That's the new research. Which of these does tummy time help with? Tummy time. That's our learning time, isn't it? And we know this helps with the head if it's flat because it will help round it out. But again, they're moving, they're trying to find that object permanence, right? Looking for that, whatever they're, that little teddy bear or that little toy, which is the muscle and the muscle development and coordination. And of course, it helps with the heads. Which newborn can have an ABO compatibility? Do you remember this from maternity? And what is this all about? Why do we need to know about ABO? We need to know about it because it has to do with hyperbilirubinemia and bilirubin levels high in babies. And as nurses, as pediatric nurses, we could take care of them. What it is there's differences. Okay, it's oh mom, a baby, and the blood is fighting. Okay, and we need to know those things. What do we do? How is the best treatment to treat that bilirubin? This is the one you have to have the lights on, baby turns a little bit of yellow. The best thing is to start feeding that baby as soon as possible. If you've ever looked at the stools on bilirubin babies, when they're fed a lot, you'll see the bilirubin come out in their stool and you'll decrease those levels quickly. Which intervention may decrease the incidence of physiologic jaundice in a healthy term infant? So again, just get those feedings started on any, as long as there's no contraindication for feeding a newborn, we need to feed them because it does. It stimulates the stool, it stimulates the meconium to come out, and it will help us determine is there any sort of problems going on. You're going to learn there are many conditions that we can figure out when an infant, a newborn, does not have a bowel movement in the first 2 days of life. So, initiating feeding, getting them stooling quick. And if they're not, we know to look quicker and it actually helps with those diagnoses. We'll go into what they are. So, an infant is NPO to their medical condition. What's important to remember? I mean, babies can be born, they have to be intubated, or a baby has a condition where they can't eat. Their insides are born on the outside, or whatever. How do babies explore the world? How do they handle life itself? And it's all about the mouth. Again, very important concept. Babies are born, some of them due to they don't have esophagus connected to the stomach, or they've got extra tubes between lungs and esophaguses, or they've got problems with their mouth, the cleft lip mouth. I can't eat. Guess what? Give them a pacifier, they feel like they're eating, they soothe themselves, they burn less calories. A baby's a happier baby. A multi. The mother of a child is suspected of having Munchausen syndrome. What could be in the care plan? Now, I'm introducing Munchausen syndrome. I've actually seen only one in my career. I had a couple I suspected. The problem in wish housing is parents like their child to be sick. They like the attention. So they do all sorts of crazy things to keep their kids sick. They could have a wound that they put dirt or things in it to keep it infected, or inject things in the IVs they shouldn't. And this is mush housing. And it's usually one person who makes that child ill. Now, what is our responsibility as a nurse? Well, our responsibility is to protect a child. It's not the parents. We always are there for that child. So
Is
the
that what?
mother can come. Go
I'm
ahead.
sorry. Is that what the girl Gypsy Rose mother had?
I believe so.
Okay.
I don't know the exact case on it, but this is that person who this child's always in the hospital with things and they can't figure out what's going on or why they can't cure something. And then every time the mother comes, things get worse if that's who that person is. Could be the mother, the grandmother, could be a friend, could be a sister, a brother, it could be anything. Anyway, your responsibility is protect that child in your care. So if it's the mother or whoever it is, when they come, they can visit their child. Yes, they can. But you will have somebody sitting in that room, a nursing assistant or a care tech or whoever your supervisor says needs to be in that room when they come. Also, if they bring anything, food or things, you need to inspect it because you don't know if that food has stuff in it. Okay. So, again, that is your responsibility. All right. You don't have to have anybody in there at all times. Yes, they can visit, but protect them while they're there and monitor. Yes, go ahead.
Is that a something that you would tell the mother that they're diagnosed with this syndrome, or is that just something that's kept amongst the healthcare workers to handle a situation?
Until we figure it out, is this something that social work, care rep, um, even the physician, it wouldn't be the nurses telling her. It would be on that level. That would have to say that they're being monitored to protect the child. Many parent would go ballistic,
Right.
usually. Yes. And it's a very tricky situation. So again, initially it's just on the down low, as in just make sure. And if we have anything that suspicion, of course, it's got to be reported. You're hurting a child. That's police report. Okay. That's child abuse. That's all of that above. Okay. So again, it's a big deal to put this stigma on somebody, but I've seen one. And it was, and you're right, it's not that pretty. Really isn't. But it's how you handle it. It's got to be a strong nurse who takes care of that child with a mother, for sure. A multi. Frequent developmental assessments are important for which of the following reasons? Select all. Why do we need to know when they roll over, sit up, when they grasp, when they walk? Why do we need to know that stuff? We know that if we're doing frequent developmental checks and we're seeing delays, we can act on them immediately. Okay. Whether it's looking at nutrition or maybe it's physical therapy, occupational therapy, speech therapy. Those are the three therapies we talk about with children. And what we talk about is early intervention, making sure that we get it quick because the best thing about kids, once you give them something, give them a challenge and what to do, kids catch up really quick. Ever have a kid who's 2 years old? My first two grandkids, they both were in speech therapy. They couldn't talk. A year later, I couldn't shut them up. I mean, they went from not one thing to the other. Again, therapies really work well early. Moro reflex, startle reflex. What is that one? We have several reflexes that infants have. Moro is one of them. You walk into an infant's room and you hit their crib when they're asleep, and all of a sudden their hands and their feet come up like that. It's a startle. It's like, oh, what happened? And that's what that is called. Startle or Moro reflex. A multi. What are risk factors for SIDS? So we know males more than females smoke for sure. Recent viral illness because their nose gets plugged up with mucus, so it affects airway. Breastfeeding decreases the risk. Very good. And last one here. Rooting reflex. Which one is that? I stroke the cheek. That's how it's done. Rooting. What am I rooting for? Miami Dolphins? New York Yankees? So a newborn infant doesn't know how to suck, swallow, and breathe, right? They don't know, but you stroke their cheek and they sort of go towards it. So a new breastfed mother teaching her, stroke their cheek to look for the breast, or stroke their cheek to look for the nipple on a bottle. It absolutely works beautifully. All right, let's see how we did on the first one here. Number three. Yeah, good job. And another Kia. Lots of Kias. And number one, Coco. Good job, Coco. Number four, Stephanie and James. Good job, guys. So we're going to go on now and go to your toddlers and your preschoolers. I think you can see by immediately getting you into that Kahoot shows you infants got a lot of stuff, but I did it right away. So you're not confused now with the other sections. So let's go to the other sections now and see if we can now separate them all. So chapters 32, toddlers. Who are toddlers? Toddlers are ages 1 to 3 or 12 to 36 months. This is the age where they're up mobile, a little bit verbal, and they're exploring the world. I love this Jerry Seinfeld expression. Having a 2-year-old is like having a blender without a lid. Turn it on. They're everywhere all at once. You can't keep up with them. Toddlers are into it all. And what else? Me, mine, and I'm not sharing. Sit down and that's it. It's those tenter tantrums. I love it, and that no, me, mine. I mean, they're getting to be very strong-willed, and it's okay as far as I'm concerned. Now, remember in that infants, they gained a lot of weight all at once and height and all that sort of stuff. All you need to know is everything slows way down. And we know they're not going to quadruple their birth weight till they're 2.5 years old. The other thing we know is that their fontanelles close by a year and a half at the latest. We know their head circumference is going to be equal to their chest or smaller. That we know. And they're going to get longer and start to become more and more graceful as we get older. So potty training, right? Is going to be part of what we're doing here. We're understanding that we have urine, having the ability to hold it. This is a time where toddlers are going to be sick all the time. I think most of us have to have our children in daycare because everybody has to work or go to school or a combination of everything, right? So, what do toddlers do all day long in daycare? They play. And they play with what? Toys. What do they do with the toys? They put them in their mouths. And then the next kid gets it and puts it in their mouth. And they swap spit all day long, right? And what does this do? It takes germs and it passes them around. Now, yes, your kid in daycare is always going to be sick. Is it a bad thing? Well, you don't want your child sick, but your body is building all of these antigens and antibodies and building up defenses. So by the time they get to school, they already have this good defense against all the germs that they can get. That's part of it, okay? Now, as we get older, you're going to see gross and fine motor skills are both going to become more and more refined. So, refinement of coordination is about 2 to 3 years old, okay? That's, getting up in the toddlers. We are going to be using both hands about a year, 15 months, and about a year and a half. It's going to take a ball, going to throw it at you. Be careful. Sometimes they throw really fast and really hard. Their eyes, remember, they were working one at a time, right? They didn't work together. Well, now your visual is 20/40. And now that depth perception is getting a lot better. Now, eating, nutrition. As an infant, have you ever tasted what their foods taste like? or what formulas taste like, especially if they've been placed on these really special ones like Nutremigen or Alimentum. They look like oil and stuff, and these infants, they love it to death. Well, once they become toddlers, all of a sudden their sense of taste starts, becomes more and more refined. So now they become picky, picky, picky eaters. Of you who knows toddlers, don't you know they love chicken nuggets, macaroni and cheese, and apple juice? And that's what they want every meal, all day long. They're hard, hard, hard to feed. We know that. What happens? Because of this, many toddlers become anemic because they're not getting all the iron they need. So, again, toddlers' nutrition and this pickiness, we got to find ways to trick them to eat their foods, right? So, let's talk Erickson and let's talk about the people around them. So, what is a toddler doing? They're becoming autonomous, which means they're doing things for themselves. May not be done right, accurately, but they want to do it themselves, right? So that's my autonomy. That's me, mine. I'm going to do it. Let me try. What is this shame and doubt? So it's autonomy, what that child's going to do anyway. I'm going to do it versus all the other people around them, grandma, mom, and dad, are giving them shame and doubt. And how do they do that? Well, be careful. Don't do this. You're going to fall. Get down from there. Let me get you down. Let me help you get dressed. Let me do this for you. Let me do that. Let me do that. And now that toddler doesn't feel like they can do anything. And now they have shame and doubt. They're confused. It's the helicopter mom. You shouldn't be. Let the kid try. Let them make mistakes. As long as it's not going to hurt them, right? This is what we want with toddlers. As I said, they are the no, 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 me, mine generation, okay? What helps these kids? Well, we've learned toddlers love routine. They like the same, and I think of all routines, especially if they're admitted to a hospital, it's bath time. Do you give it in the morning, afternoon, at night? And you need to keep the routine. Also, foods that they eat. Can we incorporate that into their diet? Does their dietary restrictions allow them to have those things? Okay. Remember, toddlers are all id, which means me, mine, don't care about nobody else. It's id, mine. Okay. Now, Piaget, they're thinking. Well, we know there's object permanence as part of it's there. I'm going to go looking and I'm going to find it again for sure. And then as we get into that toddler, the beginning of toddler, now we're starting to think, we're starting to do things. Think about taking a broom and making it a horsey, putting the arms out and vroom, vroom on an airplane, or drive a car around the house. This is all imagined, pretend, magical thinking. But again, remember, it's all about what they want, egocentrical, which means what I want is only about me, okay? And it makes no sense at all to anybody else but to that me, mine, toddler, okay? That is pre-operational. That is Piaget. As I said, this is where they start to learn those things like throwing that sippy cup down and mommy's going to come get it, right? So, autonomy versus shame and doubt. We know that I want to do it by myself, but you're telling me I can't. That's that restrictive parents, and you need to let them do what they can do. I mean, if they're going to fall and hit their head on a cement floor, you're not going to allow that. You throw a cushion down, let them hit the cushion. But again, you've got to let the kid try those things. Again, this is what they part of that. So they're starting to learn that there is a difference in boys and girls. This is common. They're starting to look at their private parts and whatnot. Remember, this is potty training. So they're going to look at mommy peeing and daddy peeing and different people and realizing there's different parts. It's okay. Remember, they say to use real terms, penis and vagina is better than all of these other nicknames that we have, so that there's one word that everybody knows in case. We know that we know what men do or girls do, those gender roles. Who does what in the house? What does mommy do in the house? What does daddy do in the house? We know that as a toddler, they don't want to be away from you. We know they know that there's who other people are and who they are. And we know that these children in situations, if they have these transitional objects like their teddy bear, their favorite blankie or jammies or whatever, this can help, with, being like in a hospital or an outpatient setting or et cetera, in a doctor's office. Language. Well, infants should have, one word sentences: mama, dada, milk, more, mine. Okay. That's, infants. As we get older, by age 2, it's multi word sentences. Okay. As we get older, they're going to be more and more independent. They're going to want to feed themselves. Would you let your baby feed if the spoon was upside down and backwards and they're trying to shove it in your mouth that way? Yes, let them try. You can show them the right way, but the attempt is what you want. They're not going to get it perfect at first. I always arrange bath time after feed where I know it's going to go head to toe, right? Because you got to give them that chance to feed themselves, to undress themselves, to dress themselves backwards, inside out, doesn't matter. They're attempting it. Let them try. We know that they are strong willed. Okay. Play. What do we know about toddlers? Me, me, mine, mine. So, parallel play is the big play on toddlers. They'll all play in the same room, all next to each other, two or more kids, right? But they're not sharing. They're playing in their own parallel, all right? Potty training. We know they have to show that they are getting ready for potty training, which means they have to know that when they can be dry for 2 hours. Okay. Some book says 4 hours, some says 2 hours, but you see that they're able to maintain themselves dry and they're going to be telling you, they want to go. We know that other kids in the house, there is going to be rivalry, especially if one kid's in a hospital all the time. So I always do things to try to incorporate them, whether sending home a hospital coloring book and crayons to the other kid. It's little stuff like that helps. We know toddlers temper tantrums. They want what they want when they want it and they don't want to listen. Bedtime can be difficult with toddlers. So again, it's that wind down, that negativism, all about me, me, mine, mine, egocentrical, all about what I want. And then what happens with toddlers when they get stressed out? Well, they're going to regress. If they've been potty trained, they might become incontinent. If they don't have a pacifier, they might get their finger in their mouth. I mean, they're going to regress. They're going to try to comfort themselves in some manner. As I said, nutrition, toddlers, it is that physiologic anorexia because they're not going to eat as much as they do. Again, you've got to be careful with people with special diets, for instance, vegetarian, making sure there's enough iron in there. Remember, if they're only on whole milk, that means they're not getting all that other calories from, a formula. Remember, they still need calcium, vitamin D needs to be put in there. No, things like protein is good for wound healing. All right. Again, you can use nutrition to help children feel better and adults, doesn't matter. And we know there's all sorts of complementary alternative medicines, and they're all okay as long as they don't interfere with the medicine that we're administering to them. Dental health. Children should have their teeth brushed with just a toothbrush when they start getting them right. As they're getting into toddlers now, teeth are coming in. Now we can put toothpaste and we could do fluoride. They should floss. But know that a child less than age 6 or first grade, they don't have the dexterity to do it. So they'll need help. Those little stick things are better today, but again, they need help younger than age 6. Kids will eat anything, they will ingest anything. Know that first thing, a kid, they come into the ER, they said they just swallowed whatever substance. You know, what are we going to teach? Number one, call poison control first, then do whatever they say. Don't just go directly to ER or call ER, call poison control. And I'm telling you, they have the most up to date information that you can have, whether to vomit, drink milk, eat a piece of bread, not vomit. Okay, all of those things. We don't give Epicac and we don't promote actually vomiting at home anymore because it could burn coming back up. The most common thing that I've seen that kids eat is their Flintstone vitamins. And thank goodness, because they're just going to urinate out extra vitamins they don't need, as long as it didn't have iron in it. Remember car seats. Remember, infants must be restrained, shoulder restraints. You can pad with underneath them, put rolls next to them, make them nice and tight in there. And again, till they're 2 years old, rear facing. Then you could turn them around. Know that water safety is so important on children. So back seat, rear facing, 2 years old, shoulder straps, and then the center, the back seat, as I said, good rolls. You can't use old car seats because they update them according to research and they make them better and better as they go on. We had all those coordinations here that we did already. And now preschoolers. So preschoolers, we're ready to go to school now, right? This is ages 3 to 5. How do we teach parents to get these children ready? It's basically reading to the children as much as we can and giving that positive attitude for home. I know I look at my daughter with the older son, which is in the 3rd grade. The amount of work is insane. I don't know how they keep up with it all. But again, being involved with it, giving that positive attitude. Their growth, there's nothing really significant. It slows down. Again, everything slows down with their growth. Gross motor, depending on ages 3 to 6. Preschooler, ages 3 to 6. Wanting, walking, jumping, hopping, skipping, all of these things as they get older gets more and more in finesse, okay? Erickson. Erickson talks about a sense of initiative. So this is about the people around them. They're trying to do good things, right? They're trying to think about others. But there's a problem with that initiative because these children, excuse me, sorry. I went the wrong way. The problem with these children with doing things right and wrong is they don't always do it right. And then they feel bad. They have this sense of conscience now. Remember, toddlers don't think about anyone, has no conscience at all. They're on id. Now preschoolers are starting to develop that. Also, let's put in here Kohlberg. They're starting to know right and wrong and the consequence for each. We know preschoolers, they're starting to get ready for school. Again, promote activities that promote that. Their development, again, they're in more magical type of things. Their language, they're speaking bigger sentences, more words. They still don't understand 2 o'clock in the afternoon, mommy's going to come pick you up at school. They don't understand that. They'll understand after lunch, mommy's going to pick you up. In the morning, when the sun comes up, we're going to go in the car on a ride. They understand events and time. They don't understand the clock, okay? And they understand, again, magical thinking. Again, Kohlberg, reward and punishment, right, wrong, consequence for each. Preschoolers think if they get cut and blood is coming out, all their insides are going to come out and they're going to die. Ever see a preschool, you put a band-aid on it and everything's all better. They have a feeling, they don't understand that it's going to stop the bleeding, that you're going to be okay. They just think everything is going to come out. Again, they don't like intrusive, like needles. They think you're going in there and you're going to get them. Spirituality. Again, you only have to know your spirituality. You don't have to agree or understand with somebody else's, right? Children, this preschooler, they only know what they've been taught by their family or significant others. The one thing, just like that Mexican who believed that God's punishing them, preschoolers think if they fell down, broke their arm, they got an appendix that needed to come out, they did something wrong. God's punishing them. Again, they're starting to do mom and dad understanding. They're starting to become more modest about it. They don't like to be naked in front of you as much as they used to. They're more, get out of here, close the door. Also, they're starting to talk about, babies and where they come from. And they're starting to touch themselves more. And the thing with this, especially the younger preschoolers, and if they're touching themselves in public, say, go to your private room. I wouldn't, say stop, just go somewhere where it's private. We don't need it. Social development. Now, they are, again, still stranger anxiety, um, not as much as your toddlers. Again, security comes from that blanket, that doll, that toy, that truck, that whatever it is, special pacifier if they're still at age 3, but some parents. Again, these are things that help keep them calm and feeling okay. And we know play therapy. We have people that come in, these child life specialists, they come in and they do play therapy, and that does help. Social development, again, we're talking more and more complex, and they're making up words. I think teleportation was my grandson Christian's word at this age. Everything was being teleported, and everything was that word. I don't even know if he really understood what that meant at that time. The ritualism of toddlers is not as bad in preschooler. They can tolerate change a little bit better. They can dress themselves. They want to please you. But again, they only know their family and their culture. But they're going to start the question, but James at school said this. And what does this mean? This is going to start. Play. We are now associative play. We're all playing with all the toys all together, but we're not making anything. Nobody wins. Yes, imitative play. We're imagining. Dramatic play and mutual play is all part of it. Sex education. Again, use proper words. Know that kids at this age, as I said, they're going to be touching themselves. It's just a part of that exploration. It's a private act. Tell them to go to the bathroom, go to their room. They don't need to be there with you. Their fears, the dark. I don't know where they get this ghosts and big animals from, but they do. It's get fear. They want the lights on everywhere they go. Um, Again, they're afraid of objects or people associated with pain. What does a nurse do every time we see him in a doctor's office? We stick them, right? They're afraid of us. Speech, we know that many of them, we say, all right, they're not speaking as many words. Let's get them into speech therapy. And again, the sooner we put them in, they catch up so quickly. Sleeping at night, they're not as much. But again, this is night terror time where they could be still asleep looking, but they're awake walking around, screaming and stuff. My second grandson had night terrors. Injury prevention, again, safety, injuries, always going to be part of every exam. Using proper equipment, bicycle and car seats, all of these things. Children are with the family to start with. Now they're starting to break away. They're starting to go to school more. Now they're in preschool. They have things that they're learning, teacher, other people, other children. Now they're starting to get more varied. Communicable diseases, we know they do go around. The one disease they talk about is chickenpox. Know that chickenpox, you're going to catch it because there's no rash. And the 2 days before no rash is when you catch it. And they cannot go to school until all the chickenpox have dried up. Eye infections are big. Again, it's the washing hands, using the proper ointments or the solutions. Remember to tell them the ointment makes their eyes blurry because that's what happens. And then stomatitis or cold sores on the lip, they hurt. Making sure they have proper medicine. Again, prevention. We also have parasites and worms. Kids going outside, playing in the dirt, the sand, long nails, eggs get underneath, they come home, they swallow it, and then it goes, and now they have pinworms. Child neglect. There's physical, emotional, and there's psychological maltreatment. Know that with neglect, it is your responsibility as a nurse to protect a child. I've seen quite a few neglect cases, and none of them were nice at all. Just know that your job is to protect the child and report it in the proper manner. It's better to be safe than it is to have a kid out there being abused, okay? We already talked about mush housing. And then child neglect. What you usually will see is a difference between the injuries and the story they tell you. Or you're going to see that child just not answer, be quiet, and just look at that, whoever the person's with them, because they won't talk. So the nurse, their 3-year-old daughter and a male cousin of the same age has been inspecting each other closely as they used a bathroom. Which of the following is the most appropriate response by the nurse? See, at preschoolers, they're checking each other out in the bathroom together. What would you do? What's the best way? Yeah, what you're going to do is this. You're not going to condone it, or you're not going to say it is bad. You say, okay, come on, let's wash your hands. Let's go. Let's get something to drink. Let's go outside. Let's play. Change the subject. Get them out of there because it's normal for that to happen. You just don't want it to be happening like that. All right, let's go to our Kahoot and then we'll be done. Any questions? Willette and Remington, please come on camera, please. Hold on. Willette, come on camera, please. Willett, could you come on camera, please, Miss Cooper? Does anybody have her phone to text her to tell her come on?
Mhm.
Thank you. Appreciate. My last thing in life is to ever remove anybody from a class. I'll always do everything to get that student back on.
She said
All right.
I'm on the phone now. B, she said
She'll
she
be,
lost connection and everything.
I appreciate that.
She said
Thank you
she hear
so
you
much.
talking. She said she hear you talking, but she said she just can't connect.
Okay, thanks.
Hmm.
Appreciate.
Okay.
Types of play considered to be
Yes.
sense pleasure play.
Mhm.
Sense pleasure, what is that? This is part of growth and development and letting them learn.
Same. Same. Right.
So 10, it's that with the fingers and smushy, sand, finger paint, mashed potatoes, all of it is just part of that growth and development. Very good. What type of play is considered cooperative play? So when we talk about cooperative play, what do we talk about? Two or more kids with a goal. And right here, what is a goal? It's playing checkers. It's not sharing. It's not paying by themselves. It's not driving a car. It's two or more together, a goal. In this case, somebody wins the game of checkers. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, what? Kohlberg, what does he talk about? Morality. What is morality? So, Kohlberg, right and wrong and a consequence for each. And we know preschoolers call it reward and punishment. Which nursing action is appropriate to teach a preschool child about a scheduled procedure? You got to teach a kid, ages 3 to 6. They're going to have to come in, they need to have outpatient surgery. What are you going to do? Again, down on their level, developmentally appropriate, and use a doll. Absolutely. Good job. Before performing a physical assessment on toddler, the nurse should do what to encourage cooperation? Before you do a physical assessment, how are you going to have that toddler cooperate? Remember, it's from least to most aggressive, right? We want to do the least physical contact at first and then after fine. And again, are we going to be using some play to do that? Yes, but we start with not touching them much and then going into it. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? Get a 3-year-old child. They're young. This is the one that you're going to have the doll out and you're going to be showing them maybe where you put the IV or where the x-ray is going to be done or where they're going to touch you. Absolutely, that will work. And again, using body parts and play and all of that. Before assessing a 4-year-old child, what techniques would you use to approach this child? You walk into the room, got to assess a 4-year-old. and they got the cutest little, freckles and biggest blue eyes. I'm going to say, oh my God, your eyes are gorgeous. Where'd you get those freckles from? I need some. Or, oh, you got a Batman shirt? Oh man, I love Batman too. What do you think about Goofy? And this will be the break open point for a 4-year-old child. They'll think now that you're pretty cool. What technique can be used to examine a toddler? So again, you're going to use those play to do the body parts. You're going to do from least to most aggressive when you're doing your assessment, and you're going to be doing it. Using body parts and show me where this is and that is, and you were listening to each other. Again, play works, and now you're not threatening. When assessing a healthy child's lymph nodes, what should you expect? Healthy. If a child is healthy, you should not feel any lymph nodes. Lymph nodes are to fight infection. They get big to put that out to fight the infection. When you're not sick, then you shouldn't see them at all. Which Erickson stages of developmental levels would be used for a toddler? What do we know about toddlers? Me, mine, I do, right? And then there's helicopter mom. Say, no, you can't do that. So toddlers are autonomy, automatically me, egocentrical mine, and everybody else telling you, no, you can't do that. Helicopter moms. What pain scale would you use on a 3.5-year-old child? And we're going to use faces. Over 3 is faces, 0 to 3 is FLAC, and also nonverbal. Very good. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So we know that autonomy is children want to do everything by themselves, and we should allow them to do that as long as it doesn't cause harm. The shame and the doubt comes when we're trying to protect them. We're trying for them not to be hurt, to be careful, and we don't allow them to fall and do what they have to do to learn things. So that's the shame. A 2-year-old boy is playing with mud and dirt. What type of play is this? And we know that sense pleasure, it's touch and that's the feel. Kids love it. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. Is that what a toddler does? Absolutely. It's absolutely the description of a child. Me, mine, and I don't care. I love toddlers. What is descriptive of the preschoolers' understanding of time? A preschooler, ages 3 to 6. What do they know about time? So, preschoolers, they don't understand a clock. They understand after lunch, you can go home. In the morning, when you wake up, you're going to grandma's house. They understand events. They don't understand clocks. They don't understand morning. They don't understand afternoon. What age would most children could understand under, on top of, beside, and back of, over, around, all of that stuff? And again, forget if you have children, because this is the book. This is not what children do. And it's at 4. Most people do pick 3 years old, but again, the book is 4 years old when they can do it. In terms of language and cognitive development, a 4-year-old child would be expected to do what? 4 years old. A preschooler. So take your clothes and put them in the dirty laundry. Why don't you go inside and go sit on the couch? Yes, follow simple commands. Absolutely. They don't think abstract. That's more of adolescence. They don't quite understand other people, and they absolutely don't understand how to conserve matter, as in, how do I save this because I need it for another time? If they want it, they're just going to take it. What pain scale would you use to assess the pain of a toddler? Well, what age is a toddler? Ages 1 to 3. Which one is it? And remember, a toddler is flat scale. Ages 1 to 3. 0 to 3, nonverbal, flat. 3, and it could be anybody, is your faces. We know that the book says numeric is age 8. A multi. What are the cognitive characteristics of a child, ages 2 to 7, and that pre-operational stage? This is when they take the cup and they throw it on the ground. This is when they take a broom and make it into horses. This is all about that they can use things to represent. That broom is now a horsey, right? And it's all about being imaginative. But they still don't understand other people yet. They still don't get there yet. That's now school age. A 2-year-old has difficulties in activities, sensory sensitivity, and only speaks one-word responses. How are you going to assess this child? We know that this seems different. I mean, 2-year-olds love activities, love anything sensory. What would be our concern? Now, I put this in here just to know there are different checklists according to children in different hospitals and organizations. Know that this doesn't seem right. So we have a checklist that we can do to diagnose to help. Which fine motor skill is expected of a 4-year-old child? Fine motor skills for a 4-year-old. So 4-year-old should be able to button a shirt. Skip is actually 5, tying shoelaces is 6, walking up and down stairs is 18 months using alternate feet. So again, another fine motor. Again, some's motor, some's fingers. What gross motor skills should a 4-year-old be able to do? Gross motor. Get up and go, go, go. This is movement. So you should be able to walk upstairs, both feet, hop on one foot. Jumping rope is not till age 6. Shoelaces is fine motor fingers. Multi. Which would alert the nurse to hold the digoxin on a toddler she's caring for? So, digoxin. We have to worry about heart rate. We need to count it for 1 full minute and apical. What's the normal heart rate on a toddler? Should be over 100. So, what else? Potassium level is low, digoxin level is too high, and pulses don't make a difference with digoxin. So again, I'm showing you why you need to know the differences in heart rate with different age children. These are the sort of questions you'll see. How can you prevent otitis media in children? So this is all about cigarette smoke. Remember, cigarette smoke SIDS death and it decreases incidence of otitis media. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? I think as a pediatric nurse working in an emergency room, this is probably the biggest thing that you're concerned. Kids just don't want to take their medicine. So what they say is a straightforward approach. What does that mean? Well, would you like a pill or would you like a liquid? You want a liquid? Do you want it in a spoon? Do you want it in a cup? And would you like to have a popsicle afterward or some Gatorade? I mean, this is that straightforward. This is their choices, and then they have to take it. Hopefully, it works. Which intervention helps a hospitalized toddler feel a sense of control? What do toddlers need when they're in a hospital? Toddlers need that absolute routine, okay? And remember, feeding, if we get those foods, and it's bath time is a big thing, especially if it's a toddler who's cognitively delayed. This is that child. Bath time, foods, routines, this is the big, really, really important. Another multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? As I told you, I had one essay that had 4 ABG questions on it. So I try to hit you with one almost every week. So diarrhea, you're losing fluid. So of course, you're going to be worried about your potassium going. When you have diarrhea, you lose alkaline because that's your enzymes. Your digestive enzymes are alkaline. What is left is acidosis, okay? And then sodium is not part of it. It's just losing potassium, and you're left only with acid because your alkaline is gone. Last question. Normal language skills for a 3-year-old child. So a 3-year-old should have 4-word sentences at this point. 1 to 2 is up to age 2. Remember, 1-year-olds are 1-word sentences. 2-year-olds are 2-word sentences. So a 3-year-old goes up to the 4. Coco, good job, Coco. And number 2, Lex, good job, Lex. And number 1, drum roll, bing, Kia, good job, Kia. And a Rem and a Nokia, good job, guys. All right, that's what I have for today. I'll be posting this recording pretty soon. You know me. Know that next week is all exam reviews. They go from Monday to Sunday. So you have all days except Thursday. Every day there's nights, there's mornings, whatever. I do mine on Tuesday at 6 p.m. If you want to come, again, you'll get all the recordings and one announcement. It'll be there for you. Any questions? You all have a great evening. Thanks, guys.
You too. Thank you.
You're welcome.